Have you ever tried mindfulness and thought, this doesn't seem to be working for me? Or this is not what I think I'm supposed to be feeling. Or maybe instead of feeling calm, you're feeling like you want to jump out of your skin. Hi, I'm Brad from Neurodivergent Insights. And this week, Dr. Megan, Anna Neff, and I are talking about mindfulness and how we can actually make it work for neurodivergent minds. For a lot of us, the way we may have been first introduced to mindfulness just doesn't work for our neurodivergent minds. Instead, Dr. Megan Anna Neff is offering us a technique called mindfulness on the go. And that's what we're going to talk about in today's video. It's a way to observe our thoughts and maybe find out what's happening inside of our body without judgment. In this first of two parts on mindfulness and being neurodivergent, Dr. Megan Anna Neff helps us better understand what mindfulness actually is and how to adapt it for our neurodivergent needs. And spoiler alert, we are not planning on emptying our minds. A quick reminder that our videos are not meant to be a replacement for therapy. Dr. Megan Anna Neff is the author of the Autistic Burnout Workbook and Self-Care for Autistic People. They are also the creator and founder of Neurodivergent Insights. Dr. Neff is an autistic ADHD clinical psychologist who blends research, clinical insight, and lived experience to make sense of adult neurodivergence. They create clear, compassionate, neurodivergent affirming education for autistic, ADHD, and AuDHD adults and the clinicians who support them. So we started our conversation off with what exactly comes to mind when we think mindfulness?
What came to mind before I went through my psychological training would be very different than what comes to mind now. Now I get actually really excited to talk about mindfulness. I love this topic. I often say mindfulness and learning how to be mindful is one of the best things I've done for my mental health in the last 10 years. Now, before I went through my psychological training, I would have rolled my eyes. I would have, what came to mind would have been an image of someone perhaps sitting on a pillow and forcing their mind to be still. I also would have confused mindfulness and meditation, and that whole genre of wellness and self-care just didn't feel accessible to me. It's something that felt like almost physically painful to try to do. Like I'd want it like crawl out of my skin because it would just feel so intolerable anytime I would try a mindfulness or meditation activity. And so it was something that I did not have a positive association to 10 years ago, but I now feel very different about mindfulness.
I feel like when I was first introduced to the concept of mindfulness, it was very similar. It was just kind of like, because it feels, when you don't have enough knowledge about it, it feels very performative. It feels very fake. Like on this side of diagnosis, I would say it feels like I'm extra masking and trying to be something that I'm not. How did it shift for you?
I think for me, learning what mindfulness is and what it isn't, and learning that mindfulness can be active and it's not so much an activity that we do as it is a way of being with ourselves moment to moment. And so that's something that I could incorporate and I could do. But when I was locked into the idea that mindfulness is an activity and I have to set aside 5 or 10 minutes to do a mindfulness activity, that felt very inaccessible. And so that was the shift when I realized this is something that I can do on the go with me because it's just a different way of being with myself.
You've written that it's what many of us get or have the wrong impression of, rather.
Right. Yeah. A lot of the ways it's traditionally talked about or the messages we've maybe absorbed throughout our life is that it's like an emptying of our mind, which for ADHDers, that's just not really going to happen. And if we attempt to do that, it's actually going to be very distressing for us. Or that it's exactly more meditation, probably that idea of sitting on a pillow, being still. If we shift to thinking about mindfulness as a way of being with ourselves moment to moment, that unlocks a whole new realm of possibility because it's really just how am I relating to the experiences I'm having in my body, in my mind. Another way of talking about this, observing mind versus evaluative mind. So whenever we're in observing mind, which is that I'm not evaluating or judging any of my sensations or any of my thoughts as good or bad, I'm just observing, like I'm tagging them almost as if like I'm a fly on the wall and I'm like, oh, okay, I'm tracking that I'm having that thought right now or that script is playing. When we're in that observing mode, that is a mindful that is a form of mindfulness because we're being mindful of our present moment experience. And we can do that pretty quickly. We can tag our thoughts or our sensations pretty quickly. That, I think, is one of the misconceptions, is this idea that it's a way of being with ourselves that we can take on the go with us as we move throughout our day, which is very helpful for ADHDers.
Where you're saying the differences between an observing mind and an evaluative mind is it's literally just that simple of I'm noting how I feel in this exact moment, and I do that without judgment or without introspection.
Yeah. And it can be. So I also think curiosity is really powerful. I think it's really powerful deepening our emotional awareness for regulation. I think curiosity opens up space. I'm not sure if I'm actually curious if the way you're describing it, of like you notice an emotion and then you dig into it, is that like a curious dig, or is it a like kind of frantic, urgent, I need to work through this, I need to solve it, like a fix it energy?
It depends on the moment and the energy, but it's usually one or the other. What I find really hard to do, and this is something I've worked on in therapy, is not do that knee jerk, I've got to fix it, I've got to get it out of my system, I've got to flush it out. Like for me, it's like I feel like I've been trained over the years to like, when you feel that thing, you've got to deal with that thing. But the mindfulness is actually teaching me resilience to go, no, I'm observing it and I'm not taking action. And that's what I'm trying to like get more comfortable.
Yeah. I'm so glad that you brought this up, because this is reminding me that, and this was before I had a neurodivergent lens, but I would notice something when I would teach mindfulness to my clients. There was a subset of clients, and looking back, I think a lot of them were neurodivergent, who when we would work through mindfulness activities and skills and they'd become more mindful specifically of their thoughts, they'd come back the next week or two and they'd actually be worse. And I'd be like, like what is happening here? And then when we dug into it, what I realized was happening is they'd become mindful of a thought. So they'd become more aware of maybe a catastrophic thought, or a thought of like, I am bad. But then there'd be like this secondary thing that would come online of like, that's a bad thought. I'm not supposed to have that thought. That's a stressful thought. So now I either like need to get rid of it, or just there'd be this secondary narrative of I'm having stressful thoughts and that's going to stress me out. And so there is a risk when we start becoming more aware of our thoughts or our sensations, that we then, in that awareness, actually start evaluating them, or try to get into that, what I call that fix it or force it energy of like, I've got to fix this is bad, or I've got to force it. And then we're actually dipping back into evaluative mind, but from a more like meta aware place. Yeah. And so that kind of snowball, I see that being more common in neurodivergent minds.
The more I get comfortable with that observing action, does that build sort of a resilience to it having impact on me?
A lot of my training was in acceptance commitment therapy, ACT for short. And this is where, so mindfulness is often taught as a core component about that. But another core component is acceptance. And I think these two really go hand in hand. If we are increasing our mindfulness, we also need to be increasing our acceptance muscle, which is when we're leaning into acceptance, it's not I like that this experience is here, but it is I am accepting that in this moment, this is part of the experience I'm having. And it also expands our capacity to hold hard emotions of like this. And this is where I'll do some self-compassion of like, this is a painful moment, or this is a painful thought. And I'll name that like, this is hard, but instead of trying to fix it or force it or move away from that emotion through like emotional avoidance, which tends to, over time, emotional avoidance, it'll show up in our body in other ways. Yeah. It's a practice. It's also a practice of emotional acceptance. Like I am accepting whether it's a painful thought or whether it's a painful emotion, I'm accepting that that's here. And from a place of a bit more agency or observing, we get to choose. And now what do I want to do with that?
Now, when it comes to something like rumination or just sort of anxiety and just sort of those looping thoughts, you write about how there's a distinctive shift in that thinking where it's like something happens and you feel like, oh, I screwed up with that thing, versus I'm a screw up. And it's that shift in that thought. Can you talk a little bit about that critical shift?
Yeah. So this, again, if we're using language from ACT, this would be talked about as cognitive fusion, when we're fused to a thought. So if we think about the human mind, like the human mind, it's a thought making machine. Like that's its job, is to, well, it has a lot of jobs, but one of it is to make thoughts. And so thoughts are mental material that our minds make. When we're fused with a thought, we forget that, and it feels like reality. And so the metaphor that I often use is, it's like if you've ever worn sunglasses with like blue or red tinted, and then like the whole world becomes blue or red. So when we're fused to a thought, like a thought I have probably several times a day, at least a week, is like, oh, I'm so incompetent, or I'm so embarrassing. And when I'm fused with that thought, it's like I'm seeing the whole world through that lens. It feels like a truth. It's my mind's treating it like a fact. And so I'm seeing everything through that lens. When we practice some mindfulness, especially mindfulness on the go, what we're doing essentially is we're taking off the sunglasses and holding them. It's the thought's still there. It's still painful, but it's no longer influencing the way we see the whole world. It's like, okay, I can see that this is a painful thought, and it's a thought. And I'm also not getting in a debate with it. I'm not like, well, what are the facts for this thought? What are the facts against it? I'm changing my relationship to the thought. I'm naming that this is a painful thought that's emerged. And I can get a little bit of space from it. So, and part of how we do that are things like, it's really clunky, but things like, I'm noticing I'm having the thought I'm incompetent. And that sounds awkward. It sounds weird. Over time, that is something that I practice in my daily life. It's one of the ways of getting a little bit of distance from the thought without getting into a debate with the thought about if it's accurate or not.
That's something I think I struggle with too, is that my knee-jerk reaction again is to debate the thought. And that's another part of this that I'm trying to work through, is not debate the thought, but instead you've offered up a leave it, which is super relatable to anybody who's ever had a dog, who's had to do dog training, which we both have, where that leave it command can be very helpful here. The command meaning in terms of how you would give it to a dog, but not obviously to ourselves, but a leave it initiation can be really helpful here. Can you explain more about that?
Yeah. So that metaphor came, I thought about that when I was training our dog, when our dog was a puppy, and how, yes, leave it. I was using that a lot because I was training. I was starting to ruminate. I ruminate a lot, especially when I give talks. Whenever I'm being perceived publicly, I'll just ruminate. And I just found myself saying to my mind, leave it. And it wasn't cruel. It was forceful. It was strong, but it was also like, you're not going to solve what you think you're going to solve here. And then especially because I have obsessive tendencies, I think my mind thinks it's fixing things by like rethinking things over and over. And so it was a way of stepping in from a more observing part of myself and being like, hey, Megan, Anna, leave it. Like, that's actually not serving you in the way you probably think it is.
Yeah.
And so just leave it.
I feel like it's our brains looking for an in that it can then go back and fix somehow magically, that we can go back and go, okay, well, if I go back and I do this, or say this, or say that, I'm going to fix that thing. When again, it's not necessary.
Well, and that is part of the human mind for why humans have evolved the way we have, is we're good at worrying. And worrying isn't necessarily bad, because there are situations where if we go back and we're like, okay, if I'd done this differently and this differently, that would have happened that way. Okay, next time I'm going to do it this way. There's times that kind of thinking and that kind of worrying is helpful. It's problem solving. The tricky thing is the mind doesn't always know what is helpful worrying and what is unhelpful worrying. So then part of the role of the observing self is to kind of be able to start learning what's helpful worrying and what's the kind of ruminating worry that is not helpful. And then can I tell my mind to leave it, and to, maybe we go and distract, maybe we do something else. But that is the seduction of worrying, is that sometimes worrying is useful for us, especially for neurodivergent people with masking. A lot of it is that, like, let me do the postmortem on awkward conversation to figure out what went wrong so that I can do it better next time. And that has served a lot of us well. And so it gets extra sticky of, okay, sometimes this sort of worrying is helpful, and then sometimes it's not.
Yeah. Well, and I feel like that's where your advice about getting curious really comes in to play here, because the more we can kind of get curious about that, I feel like almost the curiosity replaces the need to do that sort of fix in the worrying. Mm-hmm. Does that make sense?
Yeah, I think they're opposite energies. I think a fix it, force it energy is kind of constricted, and it's let me get rid of this. And I think of a curious energy as expansive. It's let me make space for this, let me understand this. And I also think that's what helps us be able to start identifying where the cultural narratives we've internalized have influenced us. So, for example, now when I notice some pretty horrific things, my mind might tell me, I might be able to tag like, okay, I think that's some ableism bubbling up, or, oh, I think that's a cultural script around how mothers are supposed to be. And so with that curiosity, I can also start kind of tagging where this got baked into me, and I can contextualize it as something that's bigger than me.
It's so much kinder too to yourself. That other energy is more critical, whereas this energy invites more kindness to yourself, I feel like.
Kindness and I'd also add like validation. And that's, some people really benefit from CBT. So what we were talking about before about getting into debates with our thoughts, that would be like, oh, I'm not incompetent. Let me look at the evidence for it. Some people really do benefit from that, but the risk can be that sometimes we're kind of invalidating our experience. But when we can contextualize like, oh, it makes sense this thought is here because of XYZ, we're validating our experience that we've had in the world. And so that's another reason that this approach works better for me. The other thing I'll just name here, you've perhaps noticed I'm talking about the mind versus my thoughts. That's even just saying it that way is actually another way that we create a little bit of distance from our thoughts by being like, oh, my mind is telling me this story right now, or my mind, it does this or that. That's another way that we create a little bit of that distance and create some of that, what's called diffusion with our thoughts.
We're going to continue more of this conversation in part 2, and we're going to specifically focus on ADHD and mindfulness. We're also going to dig deeper into that observing mind and the evaluating mind without actually fighting with ourselves. I hope you can check that out, as well as the other videos here on our channel. If you like and subscribe, it really does help us grow. And be sure to check out neurodivergentinsights.com, where we offer up more blogs and workbooks and resources and videos and trainings. We also invite you to sign up for and subscribe to the weekly Neurodivergent Insights newsletter, which is essentially what we're doing here in these YouTube videos, but it's a weekly article and newsletter written by Dr. Neff, which you can find out more about on neurodivergentinsights.com. If you're looking for an audio-only version of these conversations, you can go to your preferred streaming platform and just search Neurodivergent Insights. And there, wherever you get your podcasts, you can listen to this conversation as well. Thanks for watching, and please be sure to check out some of the other videos while you're here, and let us know in the comments if there's a topic you'd like for us to cover. And be sure to check out some of the other videos while you're here.